There we go. Hey, welcome everybody to the Optimal Longevity Series. My name is Jeff Ashby. We are already broadcasting from the road, Lake Tahoe here tonight. Going to be doing our testimonial call with Dr. Prasad tomorrow night, and then dinner with Dr. Prasad. You'll have the information. It'll come out to everybody in the company. But what a privilege it is to be here supporting Jonette Biebensheimer here this evening. This is her night. This is where she shares with us her journey. We're so excited to have her here with us during this Optimal Longevity Series episode. We've got Dr. Court here and Beth Sturdivant also as our co-hosts. And my goodness, Dr. Prasad is here as well. And I've been asked right before we even introduce Dr. Prasad and talk and introduce Jonette to take care of our disclaimer. So let me go ahead and do that. And so just give me a moment here, and I will go through it. You're welcome to follow along with me as I read. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes information on recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider. So that having been stated, I will get rid of those words and turn the time over to you. Dr. Court, are you going to do the introductions, or is Jonette tonight?
I will. Welcome everyone to the Optimal Longevity Series. I'm Dr. Russ Court, and I'm blessed to be with Jonette Biebensheimer, who's in a different location tonight, and Dr. Kedar Prasad. Jonette, if you would like to pull up Dr. Prasad's accolades, I will be happy to discuss them. If you don't have them, I happen to have a copy of them right here. Thank you so much. It is with great pleasure that I get to introduce Dr. Prasad every Optimal Longevity Series, because the man is a living legend and a dear friend. Dr. Prasad was a professor at University of Colorado School of Medicine for more than 30 years. He's the director of vitamin and cancer research. He's also the former president of the International Society of Cancer and Nutrition and a member of the London British Society of Medicine, as well as being personally invited to sit on the Nobel Prize nominating committee for candidates in medicine. Dr. Prasad graduated 3 years early to become the world's first PhD radiological biologist in 1963, and he owns 7 patents on micronutrients. He also discovered the anti-cancer fighting potency of vitamin E succinate, as well as discovering the anti-cancer agent butyric acid, the small fatty acid formed in fermentation in your gut. And he was co-discoverer of L-DOPA while he was in Brookhaven, at the National Laboratories in Brookhaven. He has also authored more than 32 textbooks. In fact, I believe he is working on his 34th textbook as we speak. He has published well over 250 peer-reviewed articles, and he is listed in PubMed more than 450 times. It is with my great honor and admiration to introduce Dr. Kedar Prasad, the living legend, and our dear friend. Welcome, Dr. Prasad.
Thank you, Dr. Court, for your kind introduction. I always enjoy working with you and Jonette. And of course, our ambassador, without whom we cannot be here, Jeff and Helen. So if you have any question to start with, or what you want, then I would be glad to go through, or anybody who wants to have a testimonial, I'm always happy to hear them.
Thank you, Dr. Prasad. And so tonight, as I was going through your body of work, preparing for tonight's call on the Optimal Longevity Series on breast cancer and beyond, I was just astounded that, you're for anybody on here, you can go look up Dr. Prasad and you can Google his research. He started publishing work in 1963 and so many papers on a variety of topics, neurological diseases, diabetes, but a lot on cancer. And I mean, over and over again, neuroblastoma, cancer, radiation papers from 1963. I pulled up a few to go through memory lane to look at his body of work. Because those of you that may not know Dr. Prasad, this is really, his work not only at the University of Colorado, Denver, being the director of vitamins and cancer research, is just, it's his body of work stands alone. But when I was going through, I was just deeply touched by your perseverance and today where we are with your multi-micronutrient approach and some strategies that we're going to talk about later. It really is remarkable work, Dr. Prasad.
Thank you.
I only could pull up 5 papers and I went, wow, there's so many papers on cancer. I mean,
Yeah.
And so let's go through that memory lane real quick, because I think it's a good thing before, let me see where, here we go. Desktop share. Pull this down. Okay, here's the first one, Dr. Prasad. I think I'm not sure, this is the first one that I wanted to kind of lay the foundation, is Cancer Prevention Studies. It's a 1998 paper, memory lane,
Yes.
past, present, and future directions. And so I was reviewing this abstract and I just thought how important your work is today, and beyond, and the lives that are going to be changed that you've, that from the work you've done. And so I'm a little nervous tonight because I'm getting ready to share some really personal stuff. So when you wrote this paper in 1998, this is really like the first paper that I saw on just an overall prevention studies. Any thoughts on this paper?
Yeah, it was a long time. At that time, I was more focused on the prevention of cancer because we did a lot of studies and proposed hypothesis why the normal cell become cancerous cell. And therefore, we found that, of course, vitamin E, after discovered vitamin E succinate, of course, it was very important to review the paper. And in this paper, I have reviewed and predicted that how antioxidant can be used, or macronutrient, including antioxidant, can be used as a preventive agent. And in this paper, I had no idea at that time, because it was so early, that involves cancer treatment. But before that, this paper was published. Of course, vitamin E succinate was discovered in 1982. And since then, I did a lot of work on cancer as well. But this was focused on the prevention issue, because at that time, I had an individual paper about the cancer treatment component, but never framed the entire concept, why it is happening and why. So prevention of cancer prevention is totally different with respect to effect on macronutrient than cancer treatment.
Mm-hmm.
So that's why I have defined in most recent patent and paper I'm writing it that preventive dose is something much lower, and therapeutic dose is 3-4 times more than preventive dose, and so yeah, this is the first time that I used a antioxidant as a selective, causing death to the cancer cell, but not normal cell. Not only that, and a good example was vitamin C that I did, and vitamin E succinate we did. Both of these agents enhance the effect of experimental standard therapy like radiation therapy, chemotherapeutic agent, and then tested almost all currently used chemotherapeutic agent. And experimental therapy is also hyperthermia. Hyperthermia is one of the experimental therapy that kills cancer cells. And so even the high dose of antioxidant will enhance the effect of a hyperthermia selectively on cancer cells. And so this was one of those papers that I reviewed in that paper and proposed this idea.
Yeah, that was in 2000. So the first paper was in 1998.
Yeah,
But you discovered
prevention.
vitamin E succinate in 1982.
Yeah.
And then this paper was in 2003.
Yeah.
And then we have the next paper, which I thought some of these for people to understand that Dr. Prasad is an expert on both cancer prevention, cancer stressors, like radiation and smoking and others, but cancer prevention and cancer treatment. So I wanted to walk everybody through for your body of work.
Yeah, that's amazing that you found out that, cancer therapy, yeah. So,
And so
they
this is
have emphasized that how, but still in that phase of these things, we have a data that they inhibit by themselves cancer cell and also enhances the effect of a standard therapy and the experimental therapies on cancer cell, but not on normal cell. So if anything, it protects normal cell in many studies that we published. And so, but I still in those days, I have no idea why it is happening. Because when you talk about antioxidant, you said, oh, they destroy free radical, cause inflammation, so destroy inflammation. But at that time, we have no idea how to explain it. But now I have an idea, and I proposed the idea.
Yes.
So it is beyond that, and so I think it is very important to remember. Many times oncologists, you say, "Oh, I'm taking vitamin," they will say, "Don't take it," because they presume that you are taking a preventive dose, and if you take a preventive dose of antioxidant or like any multiple commercially sold vitamin during, say, chemotherapy or by itself, they can stimulate the growth of some cancer, that in this case was melanoma, and also that we tested it, effect of vitamin C, for example, and also it blocks the beneficial effect of chemotherapy and radiation on cancer cell, and also it will protect normal cell. So it will protect both normal cell and cancer cell. That's not good. And so, but when you use the high doses, so therapeutic doses of antioxidant, mechanism is totally different. And that's why, even in that book, at that time, I was not aware, how can I explain it? But today's explanation is that most recent one that I was wondering about for a long time, how I can explain mechanistically why it is so selective. Therapeutic dose of antioxidant is so selective for cancer cell, but not normal cell. Then I found out that, cancer cell uses pathway of, first, cancer cell, just like any other cell, use energy. They need energy. And only one way of getting energy is a glucose. So I figured out that cancer, but glucose gets in, but they use a very inefficient system of generating energy called glycolysis. And in glycolysis, one molecule of glucose generates 2 molecules of ATP, which is the energy source. And that's why energy is expressed. But if you go to oxidative phosphorylation, like mitochondria does, normal cell does, one molecule glucose can generate 36 molecules of glucose. So normal cell doesn't need much glucose. But cancer cell, because of inefficient generating energy system, they need a lot of glucose to just survive daily and proliferate. And so and then also the glutamine is another nutrient that is used by the normal cell to make all the vital molecules, DNA, many things. There's glutathione is one of them, but also glucose. So glutamine is very important for the formation of vital molecules. Without that, you will die. I mean, cancer cell will die. And so the question then occurred to me once I became aware of this thing. Then I said, maybe it is possible that therapeutic dose of antioxidant blocks the uptake of glucose and glutamine in cancer cell, and normal cell don't need it, so normal cell has no effect. And so by using a therapeutic dose, by blocking these two nutrients that cancer needs for survival, so if you use a high therapeutic dose of antioxidant, cancer cell will die of starvation. It can't produce enough energy to survive and proliferate. Even the cell who become, say, for example, anoxic, tumor cell, as you know, tumor cell, when they are hypoxic, they become very resistant to all kind of therapy. But because they work by different mechanism, you produce a lot of free radicals. And so now hypoxic cell is there, and so they can die by radiation because they can produce free radicals. But in this case, high-dose antioxidant doesn't care. It blocks whether you hypoxic cell or oxygenated cell, it makes no difference. Once you block actually hypoxic cell require much more glucose than the oxygenated cell. So it makes no difference with the therapeutic dose of antioxidant, they will kill both equally. And so this was very exciting new. Now we can happily explain it. And since then, people have published a lot of data on resveratrol, curcumin, vitamin E, and vitamin C. I published it, but many people since then have published that it blocks so nobody can argue on this point that didn't happen. But these information are not filtered through a physician community or oncologist. That's why I told always our customers who have this kind of issue, cancer issue, then you must take I recommend it therapeutic dose of antioxidant. And I said always that make sure the oncologist knows it. And if he has any question, we can discuss with him and provide the experimental data to show. And I will publish this information as soon as my patented issue, which will be another month. And then we will run actually clinical trial, we start getting funding and so on. But in the meanwhile, people who have already cancer, we can't wait for those kind of events. And so that's the best that can be done at this time, because there is no question what we hear from many people, and during time of when they meet, that many people are deriving a lot of benefit during chemotherapy when they take it, or just take by themselves. Some people take by themselves. Sometimes they take with chemotherapy and radiation. I always recommend you must follow the oncologist's advice. If you have taken a chemotherapy or radiation, during that time, you can use therapeutic dose, which will enhance their effectiveness. It will not interfere because both are working by different mechanisms. Radiation chemotherapy generates free radicals to kill cancer cells and normal cells. But in this case, you're starving selectively cancer cell to death by depriving them glucose and glutamine.
Oh, and how much, since my breast cancer journey, how much more that you even know in your body of work than we did then.
Yeah, I will give you one example that before even these things were developed, I was just working and teaching nutrition cancer to medical students. And so the editor of Boulder Camera, she was the editor of the Boulder Camera, name of the newspaper, local newspaper. And she had breast cancer. So she found out that I do research on this. And so I suggested at that time individually, because there was no formulation. And she took seriously, and she was cured. And then when I formed the company, Scientific Nutrition, finally, with the help of my sister financing, then she wrote an article about me and my product that went throughout the country. So overnight, I generated 2,000 customers. My wife was mad because we were getting so much telephone. But anyway, so she was the first thing. And another event was there that before I developed this company, Mr. Sheffroth, who was a very prominent, wealthy lawyer of Denver, and he had a 4th stage pancreatic cancer. And the doctor said, you have a few months to go. Through somebody that I knew came to my office. I said, could you help anything? So I said, okay, yeah. But just without thinking, I recommended high doses of individual because there was no formulation. And he took seriously, and he lived 3 years with good quality of life, very excellent quality of life, attended the marriage of his daughter, which was performed elegantly. And then when he died, before he died, he said, nobody should send any flower to my funeral, any money that will spent on my flower, sending flower to me, they should donate to the Dr. Prasad laboratory.
Mm.
And as you know, I may have mentioned to you that time I collected $20,000 because he was a wealthy fellow. And since then, his wife every Christmas time will send $5,000 to $10,000. And I formed a Shaffer Memorial Fund in the university, and it will go there. From there, we will use for research. So, but now it is much more advanced than those days. But those are the very interesting example of cancer cases where high doses of antioxidant help them.
Well, I want to, Dr. Prasad, as we transition to my story, for those people that don't know, for many years, we only had one product. It was Dr. Prasad's. His body of work is based off of a multi-micronutrient approach. It is his novel approach, and based off of all of his research. But when I was 50, I was diagnosed with breast cancer, and it was a shock to everyone because I was no stranger to cancer because my spouse had non-Hodgkin's lymphoma. So I was already a cancer advocate. I'd raise money for cancer events. I'd educate on that. And so when I was diagnosed, it was a shock because I didn't have a lot of the risk factors. I mean, and we'll pull those up in a little bit. And as I was reviewing those today, it just brought back a flood of emotions and thoughts during that time. And I was just so grateful to you, Dr. Prasad, because you were like, it's not your nutrition we need to work on. We need to work on your stress and meditation. And so I did. And so I worked on my mental pharmacy, and I really worked on that to prepare for my bilateral mastectomy. But I wanted to back up and say who I was. I was at 50. I was a runner. I was very active. I had a blood pressure of 90/60. My pulse was usually 55. I had normal blood sugar. There wasn't a lot about me that was unhealthy. I had a very stressful job. I worked, I'm a biochemist, and my graduate work is in environmental science and policy. And so I worked at very large DOD and DOE facilities where I managed and inspected very biochemical warfare and mixed low-level and high-level radioactive waste. So I was exposed to a lot of very nasty stressors and in my life. And so when I was diagnosed, actually in the area where I lived near Hanford, there are a lot of different cancers because people work out in that area. So it is statistically significant. But when I was diagnosed, it was a shock. And I was misdiagnosed for about 8 months because I had dense breasts. And that is one of the risk factors that I had because they just couldn't see it very well. But all the other, didn't have any history or anything like that. And so Dr. Prasad really just, with our one product, helped guide me. And I felt so comfortable, like with all of you on this call right now, I've got a little nervous, but I was so comfortable because I looked at his body of work. And as I walked you through today, and that he just has doggedly studied this from the vitamin E succinate, he just kept on expanding until we're on this multi-micronutrient approach, and actually a patent pending for the treatment, high dose, a multi-micronutrient high dose for the treatment of cancer. But for me, it was just a peace of mind. And for everybody on here, whether you are recently diagnosed or you are a year out or 2 or 3 years out, I'm 7 years out. And I didn't realize what a big deal it was until I was looking at numbers today and statistics. And that's a really big deal. And so the peace of mind that I have from your work really helped me. So I had a bilateral mastectomy, and I actually had friends that actually came to help me and take care of me. And so that's a really, really big surgery for those of you that don't know. And our dear friends, Helen and Jeff, came for a week to help me And here I am in the hospital. I'm just out of recovery. So.
Hey guys, it's Jeanette and I'm recovering. I have no pain. I just have a little bit of pressure. And I got Helen and Jeff here, and I just wanted to thank you so much for this beautiful plant and love you guys. And we've got a lot of work to do, so I got to get healthy quick, and I'll talk to you soon. God bless. Bye.
So I want people to know on this call that Helen and Jeff took a week of their lives plus traveling to get to me, because this surgery is a massive surgery. I look like a cyborg. I mean, I have pumps and all kinds of stuff. And she took amazing care of me. Helen was just amazing, and their level of service. So thank you, Jeff and Helen. And it is very touching when you look back, and families are busy. People have jobs and careers and stuff like that, but she just didn't leave my side. And it really was tremendous. And number two, my goal was to do this without any pain medication. And so I work with both my plastic surgeon and my breast cancer surgeon, and I provided microdaily, because that was the only product we had, was our microdaily, to them. And they both approved me taking the product, and they didn't love that I wasn't going to take the pain medication. So we all agreed that I purchased it. But after I finished, well, first of all, I did about 5 weeks of meditation and mental pharmacy work to prepare my brain for the surgery. And then when I got out of surgery, I didn't take any pain medication of any kind. I just took microdaily as Dr. Prasad recommended for me. And I took arnica for bruising because that's what my plastic surgeon recommended. And I did not take any pain medication. I did purchase it in case I got nauseated, because you have to, that could cause other problems. But I never had to take it. And in 5 weeks, I was ready for my reconstruction at 50 years old. And in 3 months, I was completely healed. I was back to my classes. I was doing a type of yoga. I had full range of motion. And my plastic surgeon said that I healed faster than he had ever seen anyone heal at any age. And I was 50. And so those people that are on here, for you to understand, it seems like years ago, but when I review all of this today and I'm thinking about it, it's not that far, and there are things we need to talk about on this call, because it's not about just breast cancer. It's breast cancer and beyond, so that you can live an optimal, healthy life.
Exactly. Prevention also is the key.
It is. And even though I did all those things, I really had a lot of stress in my life and the job, that I worked in. And for everyone here, it's really important for you to know, if you have loved ones or yourself going through this, that Dr. Prasad's body of work is second to none. This is his life. This is his life's work. And if my story can help people, and I'm not asking you to not take pain medication afterwards. I just don't do very well with pain medication, and I wanted to heal, and I knew it would hinder me from doing that. But I wanted to pull up a couple things, Dr. Prasad, so we can transition. But I want everyone to know I am so grateful to Dr. Prasad. I am 7 years, so I'm a cancer thriver, and I feel so confident that the people on here can also have the same results that I do. I'm not, I just did Dr. Prasad's recommendation because that's kind of how I roll. So let's look at what are some of the risk factors of breast cancer? And I just wanted to pull those up, Dr. Prasad, and talk a little bit about those, because I think they're important in prevention. And also just because it is Breast Cancer Awareness Month, but some of the factors that we can't change, the non-modifiable risk factors, gender, women in general, it's latent, right? Because it's a duct. Age, as we age, we're more apt to have breast cancer. This is the one factor I did have. I had dense breast tissue that was dense. And so it was very difficult for it wasn't found in my 2 of my mammograms because of the dense breasts. So it's important that maybe you also get, like we have FLIR thermography camera, that maybe you have another type of image to be able to see, is there temperature differences when you have dense breasts? I did not have any family history of breast cancer, and I had no personal history of breast cancer. So I was 50 and I was a woman and I had dense breasts, but genetically, I don't have the BRCA1 gene, and I had many things in my favor. Okay. And I was very healthy, very, very healthy. But I had a lot of stressors. On the other side, some of the things that were very interesting to me, Dr. Prasad, they're really finding alcohol consumption in women is a very large factor to breast cancer. And that was newer. I mean, I've known it's been a risk factor for most diseases, but they're now really highlighting that. Obesity, the lack of exercise, of course, we know smoking, breastfeeding, hormone replacement therapy, which I never had, but if people take birth control for long periods of time, all of those things, are factors. But to me, the one on here that should be on here are exposures to class 2B carcinogens, right? Right, Dr. Prasad, there are other risk factors which you're an expert of that I wanted to talk about separate from these. What are some other major risk factors that we could prevent breast cancer?
First the thing is that you say the dense breast tissue. Dense breast tissue because cells are growing, but has not become cancerous. But it is abnormal, slow-growing cells. And therefore, at that stage, if you are defining it, don't sit down, because then you will develop later on cancer. This is the time to intervene with the therapeutic dose of antioxidant. So the tissue, all these cells which are growing slowly, which is normal-looking cell, you can say precursor of the cancer cell, they will be all die. Any abnormal growth in your body, cell growth, I mean, that can be attenuated, that can be killed by therapeutic dose of antioxidant for the same region. That's one. So other risk factor is also, for example, you mentioned that women who are on a estrogen therapy, say after menopause, doctor discourage you to take any estrogen, but some people small amount take it. But here is the thing, that estrogen by itself is not a cancer-causing agent. It is a tumor promoter, they call it. So if somebody is already initiated, then estrogen will bring to a cancerous stage. And this effect of estrogen can be blocked by antioxidant, and it has been shown in experimental tissue. That's why breast cyst, for example, cyst is like almost a density of breast tissue. Cysts grow because cells are proliferating abnormally, and that they can be suppressed by high dose of antioxidant. And so anytime you have a cyst, they can be taken care by therapeutic dose of antioxidant, because cells are growing abnormally, and anytime they cell grow abnormally, then they become later on have a risk to become cancer. Another risk factor, go ahead.
I want to talk about cysts, because that's how I found that, because I had a cyst, and so it was missed for 8 months, and I went back in because it was getting bigger. But I had a cyst that was blocking my axillary because it was blocking the pathway going out. And then I actually had a cyst on my heart, the shape of a heart. And so the breast cancer took a picture of that. And so it was really the cyst that was really the factor of why I went in. And they're like, oh, it's just a cyst, but it's really, it's my body's way. And then when they went and did the sentinel node, and they had to remove a couple lymph nodes, 3 on this side and 2 on this side, they were all clean, which is, but they were trying at one time, they were really trying to get out. And so I did not have to have radiation or any other type of chemo or anything like that. And because of my my type of cancer and my genetics. And so I just wanted to share that about the cyst with you,
Yeah.
Dr. Prasad.
Yeah,
That was
see-
the only reason I went in is because I felt a cyst.
See, at that time, if you would have intervened, and if I knew at that time I was not, there was nobody knew about high dose antioxidant or therapeutic dose of antioxidant kill cancer cell by blocking glucose and glutamine. But now somebody has it, you can block the cyst right away. So you don't have to remove all those kind of surgical issues.
Mhm. And,
You know,
and,
I mean,
and and
it's
Dr.
possible.
Prasad, and one of the things that's really important is that when you take out, because I'm sure Helen and Jeff remember this, I was very coherent. When I was talking there, I was very coherent when I rolled in. Do you know what I mean? Like, and I said, when I asked the breast cancer surgeon, why did you take 3 lymph nodes? Because that could change the quality of my life with lymphedema, and then 2. And she said I had to, because they were pronged like this. And I didn't, I had to do that. But what happens with that, Dr. Prasad, is that people get lymphedema and cording. So lymphedema they have no cure for lymphedema, but and so the quality of life, the one of the side effects is that the lymph system has a poor time working. And so I am very grateful that I do not have that, even though I had 5 lymph nodes removed, and which were all clean. But here's the thing, Dr. Prasad, they tell you to exercise, which I did, and I started walking, but you can't do too much too fast because the lymph system isn't working yet.
Right.
And so I was very fortunate. So I never had lymphedema. And I did have some cording, and cording is really where the body starts making fast growing scar tissue, and it affects your range of motion. So my range of motion was like this until Dr. Court was like, we have to work on this. Like, nobody was educating in the post breast cancer care I was getting. And so I had really poor range of motion, but now I have full range of motion. And so, but it was very painful. And so for people on here, those 2 things can really affect your quality of life. And people don't talk about that. They just say, we've got to get the cancer out. And these are some things that can happen.
Yeah, but the thing is that as soon as you detect cyst or dense of the tissue, right there, you can ask doctor that I want to take a therapeutic dose of antioxidant, because worst thing will be it will have no effect, and
Right.
best thing would be that you don't have to develop later on cancer.
And go through what I did, because we
Yeah.
could have had a strategy at least for a month or 2,
Right.
right? To
Then,
see, are these shrinking?
yeah, shrinking, exactly.
Right? And we will have, you have a size, a measurement of that cancer tumor. Okay.
Yeah.
And then after one, you can see, and anecdotally, you and I have already talked about that with one of our friends. We've already seen that happen. I have the data, from her oncologist. But I think that I wanted to show what's currently out there and what Dr. Prasad is saying. And he's an expert of this. This is, these are the only treatments really available for breast cancer right now are surgery, like what I had. Okay.
Yeah.
Radiation, different medications, and, chemo. And then
Mhm.
down here at the bottom in the complementary, they really talk more about yoga,
Yeah.
acupuncture for pain, and talk therapy. They don't even have, this is really important for everybody on here. There is another choice that is safe,
Yes.
his body of work. Okay, so there should be a 5th one on here, not just complementary. This is should be the first line of
Yes.
this.
Yes.
And now
Plus
that I know that,
experimental data suggests that this is true.
and here's the thing, it was already drug out for 8 months and misdiagnosing. What would have happened if I, instead of
Yes.
rushing to surgery and a very big surgery, a bilateral mastectomy, but what if we could have just measured that tumor and just seen in a month?
Yeah.
Right. And so for people on here, this is the future. This is, we have another option for people. So I wanted to, and I'm very grateful. And I wanted to say that as I was writing this today, I'm looking at your work and I'm like, I didn't know you did so many papers on neuroblastomas.
Yeah.
I'm like, and I go, I know that you also did one paper I wanted to share with everybody real quick that you became very famous for on the fruit flies. What was that study that really, when was that study?
What a study was that if you elevate cyclic AMP neuroblastoma cell, they become mature neuron. At that time, it was established that once you have a cancer cell, you cannot reverse back to normal cell. And so that was the first discovery that the normal cell can be reversed back, and the cancer cell can be reversed back to normal-like cells. And that made me famous. The discovery of cyclic AMP is endogenously present all the time in your body, but you have to elevate in the cancer cell to make them once you have a cancer cell, to become a mature neuron.
So why don't you now, so we walked through a little bit of your memory lane, and I really went through your papers going through from like 1963.
Yeah.
Okay. And I'm just like, out of all the papers, there are many, they're very, your work is very broad, but but what's most exciting to me is I'm like, the body of work on cancer for people on here, there is hope. And we're going to we walk through like his school of thought. Like you could see he was in the 1998 paper doing an overall review, and then how do the micronutrients work as an adjunct therapy, and then prevention, and then high dose. But why don't we talk about now specifically your patent pending on the high dose treatment for cancer, high dose multi-micronutrient treatment of cancer. Yeah. And we'll segue to that.
Yeah, I mean, this is, that's the thing that we were talking about. We have proposed a specific dose of individual antioxidant, and so this is a mixture of all those things that we have. But we did not add, for example, vitamin E acetate. We added only vitamin E succinate because they are the only antioxidant. So we take a few things that, we did not add too much beta carotene, but we added vitamin A and other micronutrient, alpha lipoic acid, resveratrol, curcumin, and so on. And so that pattern suggests that this will be, if you use this one, it becomes like you have to have a fiber total weight would be like vitamin C is 10 grams, and so they have to be delivered in 3 different doses, because one dose you can't take all so much amount, and we suggested that we start, say, 2 weeks before the chemotherapy or radiation, and continue it during therapy, and continue after radiation therapy till you are cancer free, and then after that follow the preventive dose for rest of the life, because and a preventive dose I define lower dose like we have in the micro daily EMF. Maybe you can't say the product name in the patent, but maybe in reality one can shift to micro daily EMF for preventive component of the patent. But I simply say that same dose mixture at a lower dose, preventive dose.
So the higher dose multi-micronutrient patent pending treatment for cancer is really blocking, just to recap, the reuptake. Okay, cancer needs to have both glucose and glutamine.
Right, must have.
In a hypoxic environment.
Yeah, any environment, oxygenated or hypoxic.
Cancer wants glucose and glutamine.
Right, okay. And actually hypoxic cell needs more, but they can't have it, see? Right. And so, and not only that, but sometimes they become resistant. Yeah. And they become resistant because the glutathione level becomes very high. NRF2, which is the transcriptional factor, is inherent in cancer cell elevated already, and so they become resistant because these things, anything free radical generated by chemotherapy and radiation, they can't affect because they are already high level of glutathione level, high level of NERV2, and it's already in cancer cell present. But if you use therapeutic dose of antioxidant, they don't care because their mechanism is totally different. It's not mediated by free radical. So they will block it, whether you're resistance or not resistance, it will block it. They block the uptake of glucose and metabolism, glutamine, and then they kill the cell. And it has been demonstrated in an experimental system.
So is that the actual rapidly growing cancer cell we're talking
That's
about?
right. Yeah. Which can metastasize. Yeah.
Which can metastasize.
And
But
they
then-
will prevent it.
Well, then we also can talk about, because I think this is a separate, so the cancer cells have both rapidly dividing cells, and Dr.
Yeah.
Prasad's patent is really stopping the reuptake of the fuel it needs, glucose and glutamine,
Right.
okay, for the cancer cell, but still will provide the nutrients to normal healthy cells.
That's right. That's why they don't get affected.
Okay. And then, but the cancer stem cells, and I wanted to just discuss this with you, because of the cancer stem cells, isn't it also important for them then for us to be on the your maintenance dose so that you create lower oxidative stress and inflammation, so that will help the stem cells?
I mean, when you talk about cancer stem cells, I'm not fully aware of. I mean, cancer cell also can see the one reason the normal cell become cancer cell because they can't differentiate it.
Right.
They kept dividing it.
They keep on.
Because of
There's no
mutation.
stop. There's no
Yeah.
stop mechanism.
Yeah. Otherwise, normal cell goes. So there is no such cell as a cancer precursor cell, but it could be that they are slow dividing cancer cell, but have to be a cancer cell or precancerous cell. You can say that they can be divided as a precancer, which easily become cancer cell. And so no matter, even though you are precancerous, probably will require more glucose and glutamines, they can be killed as well.
Okay.
So it has to be sometimes abnormal growth, whether you have a cancer component or just like a cyst, for example, is not cancerous, it's just dividing cell. So that may become cancerous later on if there is another mutation occurs in your gene. And so the most important thing is remember that any time you have abnormal growth of any kind, whether it is cancerous or non-cancerous, therapeutic dose antioxidant will help.
Okay. And then after, we had a question here. What if it wasn't a tumor type of cancer, but it was a metastatic type of breast cancer? What do you think? I mean, if nothing else is working, how do you feel about them taking the therapeutic dose?
Of course, they should. In consultation with oncologists, we always suggest that. And anytime an oncologist want to talk to me, I will be glad to talk to them.
Right. Well, and both of mine.
Because even though they are resistant and metastasis already, it doesn't make difference. Therapeutic dose, they will kill no matter where the cancer cells are.
Excellent. Well, let me see. And then as they transition back to the maintenance dose,
Yeah.
I wanted just to propose this for everybody on here, because I'm looking at the what's next and beyond, breast cancer and beyond, now 7 years.
Yeah.
And so for me, I'm going to do the therapeutic dose, and I talked with Dr. Prasad about this, and I'm going to do it twice a year, because I also do lab work for myself. That's a dry blood spot, just to keep what is health. And so Dr. Prasad, every twice a year, change of seasons, I do vitamin D, I do my HSCRP, which is my inflammation number, I do my A1C, and I do a comprehensive omega-3 panel, just to make sure I have, all the building blocks in.
Yeah, that's fine.
And that's my check. But
Yeah.
I want to do your therapeutic dose just twice a year
That's fine.
for a short period of time, like a couple of weeks, 2 weeks, and then a week of tapering.
Yes, right. That's
Back
very important.
taper to taper back to the maintenance dose, because they have two different mechanisms of action.
Yeah.
And so that I'm actually, I'm doing something proactive for me, knowing that we all have cancer cells in our body. Right?
This mutation is going all the time. Another risk factor that you should mention is environmental stress in not only environmental toxins exposed to, like if you work in a lab or Department of Defense laboratory. And so I used to work with the in a Department of Defense laboratory who are working on a nerve agents. And so, but we used to have all this kind of protective devices. But point is that sometimes those kind of things is also increase the risk of not only breast cancer, but overall cancer. Breast cancer happens to be in a female, but in a men as well, for example, prostate cancer. But the important thing is to remember is that the any time you see abnormal growth, that's time to start. And so avoid any exposure, but sometimes you can't avoid it. Environmental agent is not under your control. Diet is very important for I'm talking about prevention point, and even during treatment.
Right.
Take as good diet as you possible can. And like you mentioned, some of those things, avoid smoking. You can drink once a week, because I do it. No, I mean, but excessive consumption of alcohol is not good for anybody, not only for breast cancer, but for anybody. Of course, smoking is deadly for everybody.
Right.
And so, but
Dr. Prasad, we have a question. Somebody asked, could they take the collagen if they had a cancer diagnosis?
No. Answer is no. Because this is still not working in favor of cancer people. Couple of reports show that it has adverse effects. So I said, don't do it.
Okay. That was one of the questions. And one of the things that I wanted to share with people that I've been sharing for over 20 years is that I love parsley. And parsley is just an amazing nutrient.
Very tasty.
And you can add it to lots of food. It's really awesome. And so is turmeric. I know that Dr. Prasad probably has a lot of that in his diet. So those nutrients really do, make a difference. Let me see. I think this is
also another thing is the stress.
Yes.
You must have a stress is in one of the most important risk factor for any kind of illness, especially cancer, including breast cancer, is a stress. And remove the stress any way you can. Go for vacation, do yoga like you were doing it, do meditation, something that you are less. And also sometimes she's not controlled, then you take the CBD.
Take some CBD.
CBD is an intervention to make you less anxious. But even without that, you can try to relax. But if you can't do it, remove that stress by doing that, then you should take a help of the CBD. And so stress is most single factor really that can impair your all bodily function.
That's what you told me when you looked at my nutrients, you looked at my diet plan, you looked at all the things that I was doing, and you're like, it's not your nutrients, it's you have to reduce your stress. And I did.
I have faced few tragedy, but in life, many, not few, but many. But then I recover, and now at this age of mine, I'm totally stress-free.
I love that.
I enjoy what I'm doing. Another thing, when you work, you always work in an area that you enjoy it. But sometimes if you take some work that you don't enjoy for a short period of time, you can tolerate it. But I'm talking with long-term health purpose. Avoid anything that can increase your stress level.
Well, I think it's also finding your purpose for people that are on here. Maybe it is through this. One of my philosophies is that those struggles in your life are really lessons that will help you to help other people that have had those same struggles.
Yes. And when you do a natural way of doing a stress reduction, it doesn't come overnight. You have to practice every day. or at least 5 times a week, you know.
Right. And you've been doing yoga and meditation and
I
stretching
do every morning. I do
every morning, and 88 plus. And
88 plus. In 2 months, I will be 89.
yes, you will. We also had a question Dr. Court asked, and I knew he would. How about physically getting the cell phones off our bodies?
Of
Like,
course.
a lot of people are putting them in their breasts.
That is a prevention, yeah.
Prevention. It's time, distance, and shielding, which is ALARA, right?
Yeah,
Physically
right.
removing that, right, Dr.
Yeah.
Prasad? So don't put them in your back pocket. Don't put it in your bra. Remove it even 12 inches away from your body will reduce exposure a great deal.
Yes.
But with that, Dr. Prasad actually, in his textbooks, wrote about PAMARA.
Yes.
So ALARA, when you're in the radiation world, when I had to have a dosimeter, is physical shielding. Okay, and measurement. PAMARA is his way, his acronym, which you can spell out, Dr. Prasad, is really about a preventative.
Protection as much as
approach.
reasonable achievable.
Yes.
Protection as much as reasonable achievable.
Through his multi-micronutrient approach.
That's correct.
That you can educate with shielding and reducing exposure, as well as protecting yourself from the inside out.
Yeah, that's the thing. For example, there was one case report that one woman for several years keeping the cell phone on a bra, she developed breast cancer. It is one case, but if you know the biology of EMF radiation, this is what you expect. And so I think, but again, this is easy thing to do, modifiable risk factor, that you can reduce it as much as you can. That's why I always say it is almost like a diet. You do as best as you can, lifestyle changes. But no matter how much you say, people don't follow the diet, good diet. And I mean, I myself, many times, I myself violate what I say on the diet issue, because I love Indian sweet. I have cut down by 75%, but it's still.
Right. And you guys you have that a lot at night, right?
Yeah.
Sweet tea at night and stuff.
I don't take every day, but I keep in the refrigerator, and sometimes I get tempted.
Well, I think one of the things we're going to wrap up, but I think one of the things why I talked about what I measure is that what I measure is I have ways of measuring, are the lifestyle strategies, including your suite of products.
Yes.
And restorative sleep and exercise and seeing the morning sunlight, all the things that I do, are they helping me? And so I measure those so that I don't have fear for everyone on here. I have peace because of Dr. Prasad's body of work to help all of us on here. But I really do watch my blood sugar. And I think that blood sugar for me would be something just to keep an eye on, because I've already had, breast cancer, just to watch those sugars. And that just brings me peace.
Yeah.
I'm not stressed out about it,
Yeah, but also don't you have some kind of a lab that you measure for other people who can send you the blood to various?
Yeah, we do that for concierge patients too, but I want just everybody on here to just know, to reduce stress, you have to have a way of like, is this working for me?
Yeah.
And I want you to know that Dr. Prasad's, we had one product for so long. That's all we had, is this flagship product. And it changed so many lives. And now he has the opportunity. He's built the suite of products to be able to provide the building blocks to be able to help us with the endocannabinoid system when we're stressed out, with the omega-3.
Exactly.
And to help our microbiome, our gut, to be able to help with absorption. And I know that we have people on here that love the core 4+1, but I wanted just for people to know, reducing stress for me, I measure so that I know the strategies I do every day, Dr. Prasad, work for me and for the clients and patients we take care of. And that reduces my stress, because I know. and now that I'm at 7 years out, I want to thank you personally as we're ending the call. I was nervous and I was reading from my notes, but I want everyone to know what heartfelt appreciation I have for him, because he was my sage. He was my guide. And I did what he said, right? And I shared that with both my breast cancer surgeon. I also shared it with my plastic surgeon. I shared it with my oncologist afterwards. And they all love Dr. Prasad's work because you can't argue with it. And now that he has this new strategy, it should be the first line of defense, Dr. Prasad.
Yes, yes.
Okay, so please get back to the person that invited you on this call and say you're ready to get started, whether it's today, October 24th, or anytime that you see this, because there is hope for you. Okay.
So make sure it is also, we are talking about a prevention, which is totally different, and
Yes.
treatment, which is a strategy is totally different.
And a different mechanism of action. And Dr.
Action, exactly, different mechanism of action.
And also, if you want to watch this optimal longevity series video, you can go to YouTube under Team Serve for any of those. And then Dr. Prasad, you get a break for October 31st. You're going to be
that's
spending
right.
time with Helen and Jeff and getting ready, for all the amazing things going on this month. And we'll get to see you
At the October 30th, 11 a.m. Oh, this is for Jonathan, yeah.
Yeah, no, you're getting a break. So there will be no optimal longevity series next week. And we'll see you on November 7th.
Oh, yeah. Okay.
And we'll close with this, and that Dr. Prasad's birthday is January 8th. And we're having a birthday celebration
in Las Vegas.
In Las Vegas. And I want to also thank Dr. Court for being there for me, and thanking him for his support during this time, and to have friends like Helen and Jeff that supported me, and Engaged that supported me, and Dr. Prasad. And I know that for you people that are on this call that are hearing my story, I want you to know it was a frightening, fearful time, but I had a great guide, and I'm on the other side now and beyond. And I know that his life's work and body of work will help you too. So if we want to go ahead.
You know that if you are cancer free for 5 years, oncology thinks that you are cured.
Well, woo-woo.
That's the definition. That is their definition correctly, that you are cured.
Well, I really appreciate you saying that. It just warms my heart. But everybody, why don't we go ahead and unmute and thank Dr. Prasad, and we'll see you on the 7th. Thank you.
Thank you, Dr.
Thank you for your
Thank you,
Dr.
Prasad.
Thank you.
Thank you,
Joanne.
Thank you, Dr. Prasad.
Thank you for your testimony, Jeff.
Yeah, thank you.
Excellent.
That was amazing.
Tomorrow, Jeff.
We'll see you tomorrow.
Dr. Prasad.
Thank you very much.
Bye, Dr.
Good night, everybody.
Bye-bye.
Thank you.
Yeah,
Thank
we'll see
you.
you soon. Bye-bye.
Bye-bye.
Have a great night.
Bye.
Thank you. Good night.